Only one chance in 7. May 24th, 2013. Since encountering my heart condition back in 2004 and getting some stents placed in the heart arteries to keep the blood flowing to my heart muscle, I have had regular annual medicals to monitor my cholesterol levels. Because of my age, 67, my doctor has also included a request to have my PSA, prostate-specific antigen levels, monitored. Approximately 5 years ago, my doctor noticed a very slight increase in the size of my prostate with a digital exam, so he recommended that I go to see a urologist as a precautionary measure. Another digital exam, and I was told not to worry. Nothing unusual. Over the past 3 annual medicals, my PSA has been increasing slowly, but still a long ways from any real concern. Just to be on the safe side, my doctor recommended that I see a urologist for an exam, and I appreciated her concern and followed her recommendation. When I visited the urologist in February, he indicated that there appeared to be no reason for concern. Although the prostate was slightly enlarged, he could feel no solid masses. He did say, however, that the only way to be sure was with a biopsy, which would be entirely up to me. He outlined the risks, one of which was the possibility of death due to infection. Remote, but a possibility. He also told me that if I choose to get the biopsy, he will call and tell me if I have cancer, but will not discuss any treatment options with that call, as it is unlikely I will hear anything after he says the words, "You have cancer." I asked for the weekend to think about it, and called back and asked him to make arrangements for the biopsy. Biopsy was scheduled for the 3rd week of March. My biopsy doctor explained that he would inject 2 needles from the inside of my bowel through the bowel wall to freeze the prostate to minimize the pain. That would be followed by another 12 needles through the bowel wall, which would pick up samples of the prostate inside the hollow needle. It was a rather uncomfortable half hour as I counted each needle and felt the impact of the needle gun. I wanted to thank my doctor who performed the biopsy and told him to get a couple of pens from my jacket pocket. These were right on target, as he got 2 of my "We Support Our Troops" pens, and he just happened to be a military doctor who served time in Afghanistan. Once he explained his military experience, I thanked him for serving, and he thanked me for serving as a firefighter. Pens were in my firefighter jacket. He also told me not to worry, as he did not notice any abnormal solid masses in the prostate. He told me that my urologist would have the results in 10 days. It was a rather long trip home, as the freezing was coming out, and I was starting to feel rather uncomfortable deep inside. The 10th day was the day before Good Friday. It was a rather long day as I awaited the phone call. No call. That's good. Things are looking up. I picked up my aunt and uncle in Spruce Grove and took them with me to my brother's 65th birthday party in High River. I enjoyed the weekend, but in the back of my mind I was thinking, maybe the doctor didn't call because the results didn't make it to his office on time before the Easter break. Needless to say, the Tuesday after Easter was a rather long day as I awaited the phone call. No call on Tuesday, and so I breathed a sigh of relief. Then, as one day slowly morphed into many days with no phone call, I relaxed and got on with my normal life. Lanny came and helped me with the trade show, and I was really enjoying my time with him. What a blessing. 3 weeks ago, I got a message on my voicemail from my urologist informing me that he had my results from the biopsy, and could I call him back? I called the next day, but I got his voicemail and left a message. His message clearly stated that he will get back to me and that I shouldn't call repeatedly. No problem. I understand. Yesterday, I was driving to my last job of the day. Phone rings and the lady says, "This is Cindy. I'm Dr. M's assistant. Are you driving?" "Yes, I'll just pull over. Hang on." When I stopped, she informed me that Dr. M had asked her to call me. "John, the biopsy results show that there are cancer cells in your prostate." This was the phone call. She apologized for Dr. M for not making the call sooner as he was very busy. She then went on to explain that the cancer is in the very early stages, is only a low risk at this time, but this is what she wanted me to do, and then set up a follow-up appointment with Dr. M on June 24th. I want to share this story because there will be some of my friends who are avoiding going to their annual medical, or maybe you're trying to get your spouse to go for a medical and he's not cooperating. 1 in 7 men will get prostate cancer. I guess I am fortunate enough to have lived to be old enough to be 1 in 7. The key is early detection, and from there on in, one day at a time. That's all we ever have. So if you are healthy today, make sure you enjoy it.